Okay. Good morning, students, and good morning, dear ma'am. And so this is the value-added course on applications of blood stem cells in healthcare in collaboration with Dathri um, Stem Cell Registry. And today's lecture is about pre-HCT evaluation of donors and organized by Department of Medical and Technology, UIAHS. Over to you, ma'am. Thank you so much.
Thank you, Vamsi sir. Am I audible?
Yes, audible, ma'am. Audible. I will give you sharing minutes now. 1 second.
Sure.
Yes. Done, ma'am. I given sharing minutes.
Okay. So, good morning, everyone. Please pardon me with my voice today. I'm not keeping well. Are you able to see my screen moving? Slides changing?
No, ma'am. They are not changing.
Okay, then I'll keep it in this way only. That's good.
One.
Today I'll be talking about the pre-HCT evaluation of donors. This is one of the favorite topic, and I basically my role comes here also, apart from donor registration. So I'm really happy to share the process that we follow at Dathri for the evaluation of donors. So let us begin with the formal introduction. As you know, the success of HCT largely depends on the compatibility of health and compatibility and the health of the hematopoietic stem cell donor. And the evaluation of the donor is during this process, a thorough comprehensive assessment is conducted to ensure the donor safety as well as the optimal outcome for the recipient. So this process includes the donor selection criteria, because many times we have multiple donors for same patient. So there are certain criteria which we follow. Then following to that, the health assessment of the donor is done, and the ethical considerations will be discussed in the today's session. So let us begin with the donor selection criteria. So even if like we have multiple donors or a single donor, we still have to there are certain criteria that we have to consider. First and foremost is the HLA compatibility. As you know, that has to be there, otherwise the donor cannot donate his or her blood stem cells, or donor is not eligible for that patient. Then age definitely plays a major role in selection criteria. The general health of the donor, I'll talk about here. I'm sorry for the background noise. So I'll talk about the general health of the donor when we come to that point. Following to that, the psychological and emotional health of the donor is also taken care. And finally, once the donor has agreed to donate his or her blood stem cells, we have to have the informed consent of the donor. So we will be discussing all these points one by one. So as all of you know, HLA compatibility is must, and to find a matched donor, HLA compatibility is assessed at multiple loci, including HLA A, B, C, DR, and DQ. And in some registries, they go for one more factor. That is like each loci will have two values. So total 10 factor HLA report will be there, and which is being evaluated. And some registries also ask for 12 factor HLA report of the donor. So this is like to ensure the or to minimize the risk of GVHD for the recipient. So HLA compatibility is must. I'm so sorry. Then age. Younger the donor, it is better for the recipient. because young donors have better stem cells and they are in overall good health conditions. But still, donors having 40 plus age are considered for donation depending on the overall health condition and the availability of the donor. We have many cases where we had no other donor for the patient or the recipient. We have had people donated their stem cells above the age of 50 also. So the cutoff for unrelated blood stem cell donation cutoff age is 60 years. Beyond 60 years, we do not allow the donor to donate his or her blood stem cells. But if it is a family related donor or a sibling donor, then the donation can be done even at the age of 75. We have seen one case where a 72-year-old donor had donated his blood stem cells for a patient in his family, and the patient is doing good. So, but in case of unrelated donors, the cutoff age is 60 years. But as I said, young donors have better stem cells and their health conditions are good, so they are preferred. So, if we have multiple donors, younger donors are approached first, and if they agree for donation, we go ahead with their donation only. Following to comes is the general health condition. So, donor at the time of counseling, we talk to the donor, or the Dathri counselor talks to the donor and asks the donor if he or she has any active infections or any psychological issues or any chronic medical conditions that could pose risk or a history of cancer. And in case of female, the questions related to pregnancy are also asked. So, I had one donor, a very young donor, like about 25 years of age. He was a very committed donor, and from his institute, already one donor had donated his blood cells, so he was keen on donating. But during my counseling, I got to know that he's suffering from anxiety issues, and he was taking medications for the same. So he was ineligible based on the medication that he was taking. The patient's doctor denied him for the donation. So that's why the psychological issues of the donor must be taken into consideration. Active infections definitely has to be taken into consideration. And in case of female, if the lady is pregnant or uh, uh, she has a child up to 2 years of age, we do not allow her to donate her blood stem cells. And also, depending on a number of pregnancies, the female donors are selected because again there can be antibodies in the female donor depending on number of pregnancies and all. So this part has also to be number of pregnancies also has to be taken care at the time of counseling the donor. Apart from this, to ensure the donor's overall health condition, we have a long health history questionnaire for the donor, which a counselor or the collection center, where the collection center is the place where the donor will go and donate his or her blood stem cells. So, uh, like at the time, when we are talking about the general health condition, we ask the donor to fill up the health history questionnaire with the either the Dathri counselor or the collection center representative will get involved in the process to ensure the overall good health condition of the donor. Next comes the psychological and emotional health of the donor. This is also very important. Like the donor is also being assessed, and the donor should be mentally prepared for the donation process and understand the potential risks, and the benefit. If you ask me about the potential risks for the donor, I would say it is zero. I mean, see, there can be many possibilities, or many donors come with so many arguments. I have come across the donors where they say that we would like to talk to our family doctor or family physician. We say, okay, you go and talk. And then we sometimes realize that the donor's physician was completely unaware of blood stem cell donation process at all. So in that case, advice given by the family physician, I mean, uh, would not be of any help to the donor. And most of the times, almost 99% of the time, when donor goes for family physician's opinion, the family physician denies many a times lack of the knowledge of blood stem cell donation process. So definitely donors should consult the doctor who is aware of the process, and probably he or she will be able to explain about the potential risks and the benefits. Benefits, one of the most important benefit is you will be able to save the other person's life. Potential risks, as I said, according to me, it is none. But if you will Google, there are so many things that will pop up. I had one donor who is a practicing oncologist, hemato-oncologist. When I asked about, when I talked to him about the donation, he sent me a long list of possible diseases that can be there due to the mobilization process, blood stem cell mobilization process. So I said, doctor, you are a hemato-oncologist. So have you come across any such confirmed case? And he said, no. And I said, like, even I don't know. Like, and then why are you not donating? But then ultimately we found out that he had some other issue because of which he was unable to donate, and therefore he was talking about all this nonsense. But uh, there are no potential risks to the donor at all. Psychological support and counseling are available if needed. Like there are many, like the donor has to undergo many blood tests as well as the physical examination session. So sometimes donors get scared. So they have to be like supported mentally, and counseling needs to be done. So that is why the psychological and the emotional health is also important. And once all this is done, the donation process is explained to the donor. The donor has been informed about the process, potential risks, and the benefits of donation. We ask the donor to give us or sign a consent form saying that the donor has understood the donation process, the possible outcomes and the benefits of the donation, and he or she is willing to proceed for the donation voluntarily. So this consent again is not a legal binding. This donation process is completely voluntary process. So we do not, I mean, we do not say that this is a, I mean, once you sign this document, donor will have to donate or whatever. But yes, we want to be ensured that the donor has understood the donation process completely. And that is why this consent form is taken from the donor. Then comes as the psychological support. I'm so sorry, this, uh, wait, health assessment. I'm so sorry. The next comes as the health assessment. And this involves the laboratory testing, imaging studies, and donor stem cell function. Laboratory testing, as all of you are aware, will include CBC to ensure the hematological health, blood chemistry panel to ensure the organ function, including liver and kidney function, and the infectious disease screening, or at Dathri we call it as the infectious disease markers or IDMs. This is to detect about the presence of the infections that could be transmitted to the recipient. And even if there were any past infections about like hepatitis B or hepatitis C, then they must, I mean, we have to get the information about the same. And CMV virus, CMV is very important. Uh, I have already spoken about it in the previous session. In India, almost we are all CMV positive, and in other countries, the people are CMV negative. So when it comes to the donation or Indian national donating for any foreign national, CMV is the major factor in selecting the donor for the donation. Or if an Indian patient is getting the stem cells from a foreign national, then also this is very important. It's vice versa. So this all laboratory testings are done based on the values. If medication is required, donor is given the medication. Following to that, we repeat certain blood tests to ensure that the donor is in good health condition, and then only we proceed for the donation. So I will discuss some of the cases in the following session. Right now, I'm just talking about the theoretical part of this. In the coming next session, I will be mainly talking about the practical cases that I have seen in my career with Dathri. So this was the laboratory testing. Following to that comes is the imaging studies. So imaging studies includes X-ray, ECG, echocardiogram, and abdominal ultrasound to check donor's heart, pulmonary, and other body organ functionalities. So for this, we request the donor to come to the nearest collection center wherever the donor is staying. For example, the donor is from Punjab or Rajasthan or Himachal or Jammu and Kashmir. We request the donor to come to CMC Ludhiana, which is our partner hospital in uh, rest of the northern part of India, except for Delhi NCR. Delhi NCR, we have other partner hospitals, but in this for these states, the common collection center is CMC Ludhiana. So we ask the donor to come there. The body matching tests are done. Then the donor is the FRSS center hematologist examines the donor physically, looks at the reports of the donor, physical and the lab testing reports, and based on that, the hematologist will give the comment. And if required, uh, further investigations will be done or the medications will be given. Normally, in case of all my donors, which is common for like in all uh, Indian donors, vitamin B12 and vitamin D is always less. So, of course, vitamin D is very important for the absorption of calcium. And calcium, as all of you must be aware, calcium is one of the very important factor because it gets depleted when the donation is going on, donation process is going on. So, at the time of donation, the calcium of level of the donor has to be maintained. And to ensure the proper calcium absorption, the donor has to have the sufficient vitamin D. So most of the times, all the donors are lacking or they low values of vitamin B12 and vitamin D. So the supplements for the same are given to almost 99.99% donors. I have seen only one donor in my career who had normal vitamin D levels. Otherwise, all of them, be it a farmer, be it a technocrat, be it a doctor, whoever, all of them had low levels of vitamin D. So, imaging studies, and we at Dathri, we call this as the physical examination. And once the hematologist says that, okay, after if required further investigations or after medication, if any test is to be repeated, after that, the physician will say, it says that, okay, this donor is now fit for donation from our side, we can go ahead with the donation. So the next step comes is the stem cell function. This is very important and donor is given information beforehand. That is at the time of counseling only, the Dathri counselor will inform the donor about the mobilization process, wherein the donor is given GCSF injections for 5 days or 4 days before the day of donation. So total 5 days of GCSF injection will be administered to stimulate the release of blood stem cells from the bone marrow into the bloodstream so that we are able to collect the blood stem cells from the peripheral blood. This is one of the process that this is one of the way we are able to collect the blood stem cells from the peripheral blood. And we call this as the peripheral blood stem cell donation process, or PBSC blood stem cell donation process. And the other way to donate the blood stem cell is to bone marrow donation, which is very painful for the donor. Compared to that, PBSC donation or peripheral blood stem cell donation process has 95% less pain. So most of the times these days, the peripheral blood stem cell donation is done. But as I had informed you in the last session on last Saturday, uh, donor Naval Chaudhary from Dathri had donated his bone marrow for the patient Fateh from Amritsar. So yes, wherever required, doctors ask depending on the recipient condition for the bone marrow donation. And we try to counsel the donor. If donor disagree for the bone marrow donation, and if there is no other donor available, we go ahead with the peripheral blood stem cell donation, and then the blood stem cells are transferred to the patient. So, and at the end of the donation process, like during the mobilization on day 3, day 4, and day 5, we do CBC to check whether whatever injection we are giving for the mobilization, is it working or not, or the stem cells are mobilized from the bone marrow to the peripheral blood or not. So CBC is again TLC. If the TLC count is increased, we assume that the stem cell mobilization is happening. And some donation centers or some apheresis centers do pre-CD34 count. I think you are aware because in one of the sessions, the CD34 count has already been covered. So some donation centers do pre-CD34 counts and the post-donation CD34 counts. The purpose of pre-CD34 count test is to get the estimate how much volume of the blood stem cells is required to be collected in order to get the required dosage of the CD34 cells. And post-donation, as you know, to ensure whether we have got the required dosage or not. At CMC Ludhiana, we do mid CD34 count and the post CD34 count. Mid CD30 from the CBC test reports, we know that the mobilization has happened and how well the mobilization has happened. Then we do mid CD34 count where we get to know that on this volume we have got this much dosage, and now next we have to collect this much volume in order to get the required dosage. So it doing CD34 count test varies from donation center to donation centers and depends on the hematologist's decision. So even like there are some centers which do not perform the pre-CD34 or mid-CD34 count. They only perform one test, that is post CD34 donation count. They have like based on the patient weight, they decide on the volume of the stem cells to be collected, and then after the donation is over, they do the CD34 count. But this method is not, I would say this method is not suggested, or is not appropriate, I would say. Why? When I'll be talking about certain examples, I'll share it with you. So this is about the donor stem cell functions. Next comes as the ethical consideration. So informed consent of the donor is must. Donor autonomy confidentiality, non-coercion, and the transparency. Informed consent is donor has to be informed about the donation process and the risks and the benefits of the donation. Uh, I will discuss about one case which is not about the risk, but I mean something went, some issues had arisen at the time of donation. So all these issues which may arise at the time of donation has to be informed to donor, and then only we ask the donor to donate or to sign the consent form. At the same time, we are informing the donor about the side effects of GCSF, because most of the time when we tell donor that okay, we will be giving you this injection for 5 days on your arms, and because of this, the count of blood stem cell will increase in your bone marrow, and they will be released from the bone marrow and will be available in the peripheral blood. So many donors get scared, and we then like make them understand why this is required. And once they understand uh, about the GCSF, then only we ask them to sign the consent form. So the side effects are also informed, and the, uh, uh, then only we get this consent form signed. And then next comes is the donor autonomy. As I said, this donation process is completely uh, uh, voluntary process. So at any point of time during the uh, health assessment to or till the time donation, donor can back out from the donation, or donor may deny the donation. That is, I already informed you, signing consent form is not legal. So even after health checkup, donor may say no to the donation. Even after administering the GCSF, donor may say no to the donation. It's all up to the donor. But at that point of time, I tell my donors only one thing, that at the time of counseling only, I tell my donors, if you are committed, then only come for the donation or come for the health assessment and all. When you say yes and when you come for the health assessment, you are giving the hope to a family where they are looking forward to the donor donating his or her blood stem cells. So this is very important that the donor decides whether to donate or not at the beginning only. Otherwise, I mean, we would say that the donor, there will be any legal action on the donor, or but it's morally not good when the donor backs out after the physical examination or after at the time of GCSF administration and all. So, and the repercussions of denying donation once the GCSF starts, I will talk about it very soon. But like, say for example, your GCSF is to start, the conditioning regime of the patient will start from the very next day, from the day your GCSF will start. And if you deny donation, say on day 3 of GCSF, patient's life will be at risk, because the patient's all the stem cells are killed. They don't have any immunity or immune system to support them or support their life. So these days, doctors have, in fact, all the registries across the world have started taking the or talking about the alternate plans with the patient's doctor in case for any reason the donor is not able to donate or denies donation. Sometimes it happens that we completed the donor's physical assessment or health assessment and all those things are done. After that, donor gets some infection before we start the GCSF injection. And in that case, donor will not be able to donate his or her blood stem cells. Or donor may meet with the doctor to donate his or her blood stem cells. Or some influencer comes in and they say they like influence the donor, and the donor says no to the donation. So in that case, all the registries across the world have now started discussing about the alternate plans for the patient, and doctors across the world have now started preserving patients' own stem cells before they start the conditioning regimen for the patient, so that in case if the donor doesn't donate his or her blood stem cells, the patient's preserved stem cells will be given back to the patient, so at least patient can survive or his life will not be at risk. So definitely, donor has the autonomy to withdraw from the donation at any point of time, but uh, we request our donor at the very beginning that if you are sure, damn sure, then only come forward. Otherwise, please say no, because once you give hope to someone, it's not about only a patient, it's about the whole patient family. I can understand that issue very well. So, like, definitely, donor autonomy is there, but once the donor decides, donor should not, go back from the donation. Confidentiality. This is really important. According to World Marrow Donor Association or WMDA Association guidelines, at Dathri, we are not disclosing the donor and patient identity for 1 year. Uh, because again, this process is voluntary and no monetary transaction or any other uh, way to influence the donor should be practiced. That's why the identity is not disclosed. Donor gets to know patient's age, gender, and the diagnosis, and the patient gets to know the donor's age and gender. After 1 year of the transplant, if the donor and the recipient wants to meet each other, we allow them to meet each other over a video call, and then their information, contact information is exchanged, or we conduct the press conferences like the ones which I had shown in the videos in the last session. So, confidentiality is one of the very important factor or critical aspect of the donation process. Donor should not be uh, donating under any pressure, but at the same time, like we have so many donors who are like afraid of side effects of GCSF, or they do not have they do not have enough knowledge. In that case, yes, we do multiple counseling sessions for the donor, but still we maintain the transparency in the evaluation process is very important, because so in the at this point of time, we share all the reports with the donor. We share not only all the blood test reports and the imaging test reports, we share the day 3, day 4, day 5 CBC reports with the donor, and we tell them this is the issues that, and for that we are doing further investigation, or this is the issues for which you need to take medication. And not only that, as I told you, we at the time of counseling, we tell the donor about the side effects of the GCSF injections, and everything is informed to the donor. Donor is well informed, and in some cases, like now the time is limited. I'll talk about it in the next session. Uh, but to conclude the session, it is like donor evaluation is a comprehensive and multidisciplinary process which prioritizes the safety and well-being of the donor and the recipient. And the donor selection criteria, health assessment, ethical consultations are intricately woven, and they, for the successful transplant procedure, and ethical standard needs to be maintained. And this is possible with the thorough dedication of medical professionals. So thank you all for listening to me. See you all in the next session.
Yes, ma'am. Thank you so much, ma'am. First of all, uh, I really appreciate, ma'am. I know you are not well and you are taking this lecture. Thank you so much, ma'am. And students have many questions. Maybe we will continue at 11 o'clock, ma'am. At 11, we will discuss
Thank
all
you.
the Q&A session, ma'am. Thank you so much, ma'am. And
Right.
it is really a very depth lecture, and I really understood many things about donation and the related things. And we'll discuss at 11, ma'am. Thank you so much. Thank you so much.
Sure. Thank you. Thank you.
Yes.